Hello, everyone. We are so excited to see people joining the webinar with Tipton Health and Melissa Fitzpatrick today. So we're going to give everyone a few minutes to just come on into the room, and then we will kick off in another minute or so.
Great to see you, Tanya.
No, you too. I'm excited to hear everything you have to share with us today, Melissa.
Yeah.
I'm still seeing folks joining, which is wonderful. So we'll give it another 30 seconds or so, and then we'll get started. Okay, let's go. Well, I am excited. My name is Tanya Carmichael, and I'm the Director of Nursing Excellence Consulting at Tipton Health. And we are so excited about this webinar today, and we're very glad that everybody could join us. We're going to be talking about igniting joy and agility, transforming nursing leadership for healthier work environments. I want to just talk for a moment about why this is so important, and then I'll introduce our speaker to you. In today's fast-paced and demanding healthcare environment, nursing leaders face constant change, emotional strain, and organizational pressures that can erode morale and connection. Cultivating joy, gratitude, and agility through evidence-based leadership strategies is not just about personal well-being, it is a professional imperative. When leaders intentionally foster these qualities, they create mission-driven teams that are more resilient, more engaged, and adaptable. Joyful leadership promotes psychological safety and compassion. Gratitude strengthens relationships and retention, and agility empowers nurses to navigate uncertainty with confidence. Together, these qualities build healthier workplace cultures, they support personal and professional growth, and they drive organizational excellence that ultimately benefits patients, teams, and the broader healthcare system. Today, we're so honored to have Melissa Fitzpatrick, and she will share her expertise and insights with us as we explore how cultivating joy and agility can transform the way we lead and the way we care, both for ourselves and for others. I'll take a moment to introduce Melissa to you so you know how honored we are to have her with us. Melissa Fitzpatrick has over 40 years of healthcare leadership experience. She has served as Vice President of Critical Care and Cardiac Services at the Dartmouth Hitchcock Medical Center and Senior Associate Chief Operating Officer and Chief Nurse Executive at Duke University Medical Center. Melissa is a past national president of the American Association of Critical Care Nurses and was inducted as a fellow in the American Academy of Nursing in 1997. She has also served as the editor-in-chief of the Nursing Management Journal and the first ever vice president and chief clinical officer at Hillrom. In 2019, Melissa joined Kirby Bates Associates, a nationally recognized healthcare executive search firm, and as chief operating officer, or at that time as chief operating officer, and she was named president of KBA in January of 2020. Melissa provides strategic vision and direction to the organization and is the liaison to the parent company, Jackson Healthcare. In 2024, Melissa joined the board of trustees at her undergraduate alma mater, Gwynedd Mercy University, and we share a love of Philadelphia with one another. She chairs the Marketing, Enrollment, and Campus Life Committee and board, or the Campus Life Committee of the board. Since 2020, she has also served as the first ever nurse on the board of UNC Rex Healthcare. She is a member of the executive committee and also chairs its quality, patient safety, and HR committee. Melissa also serves on the board of the Schwartz Center of Compassionate Healthcare. She recently completed several terms on the Sigma Foundation board and was secretary of the board as well. Melissa is actively engaged as a member of many national nursing and healthcare organizations. She has experience as a prolific author of many articles and book chapters and serves our industry and the nursing profession at the highest level with integrity and with passion. She earned her bachelor's degree in nursing at Gwynedd Mercy College and her master's degree in nursing at the University of Pennsylvania. She lives in Chapel Hill, North Carolina, and she has 2 sons and 2 sweet grandpuppies. We are so honored to have you with us today, Melissa, and we want to thank everybody for joining us in this really important and inspiring conversation that we're about to have.
Thank you so much, Tanya. I'm sorry that introduction took so long. It makes me realize why I'm so tired all the time.
It was well worth it.
I appreciate that, hon. It really is my pleasure to be here with everyone today. And I just want to take a moment to give a shout out to Tanya and the entire team at Tipton Health Communications. We are so proud that one of the best things we did in 2025 at Kirby Bates was to establish a strong and meaningful partnership between Kirby Bates Associates and Tipton. And we feel like we bring the best of our worlds together. Kirby Bates Associates for over 30 years has provided leadership talent in both permanent search, interim leadership, and with our advisory services. And we bring all of those leaders to you in your organizations to support the important work that you do. Tipton brings their frameworks, their applications, their tools to help you on your magnet or pathway journey, to help you with looking at your leadership structure. And we feel like between the top talent and the framework and tools and talent, we are able to really help you advance your mission and advance all of the important work that you're doing within your organizations. So we're really proud of this partnership. And together, we're proud to bring you a topic that we think is very important today, maybe more important than ever. We want to cover some very insightful ground with you today, we hope. It's not every day you carve time out of your incredibly busy schedules to talk about joy. So that's what we're going to do. And I'm grateful that you've made time for us. We're going to talk about joy and agility, and really how, as nurses, as nurse leaders, we can put those two things together to enhance our effectiveness as leaders, but also to build that resilience muscle that we need so much today. We're going to talk about some strategies that you can put into play after this webinar when you go back to work to strengthen the culture within which your teams provide care. We want to look at some of those behaviors that help you remind yourself regularly of the mission-driven imperatives that we face. And certainly we want this not to just to be, fairy tales. We want this to be practical and to give you tools and maybe some ideas that you can translate into practice every day. Another goal, and this is going to happen, I think, inherently in the topic, is we're going to do a leadership glow up today. Are you all familiar with that term? A glow up is a positive transformation or evolution in one's appearance, confidence, or lifestyle. It often involves personal growth, enhanced self-care, and a significant increase in self-esteem. Now, I don't know about you, but as I travel the country, as I talk to our peers and colleagues every single day, it strikes me that we're in need of some leadership glow up. Why do I say that? Well, our reality looks something like this. What we're all trying to do in our own way is look like leadership on the left side of that screen. We want to look calm, cool, collected. We never want to let them see us sweat. We want to just walk through our work with ease, with confidence, like we got this. In reality, we're probably feeling much more like the picture on the right, which is calm, cool, and collected above the surface, but inside it is chaotic. We are nervous. We are uncertain with all this ambiguity in the culture, in the workplace, in the society. And yet we're leaders. We have to put confidence out for our teams so that they don't get overly anxious. So what are some ways that we can together lead with elegance, with grace, with intention, even though we've got all of these feelings of uncertainty and competing demands? When I'm feeling uncertain, when I'm feeling nervous or anxious about life in general, about work, about family, whatever it could be, I try to remind myself to center back with clarity on meaning and purpose. Now, we've got hundreds of people on this webinar today, all in a variety of roles. Most, I'm sure, are nurses. And what we want to center back on is why. Why did we go into nursing in the first place, or healthcare, whatever your role may be? Why did we choose this career path? I know it wasn't for the hours that we work or the outfits we wear. I know there is intention there to help others, to bring meaning to the world, to leave people and organizations in a better place than we found them. So in a time of true uncertainty and chaos and turbulence, this is a reminder to center back with clarity on our why. Refocus on meaning and purpose, and do that with intention. Not just once a year when you do some strategic planning, but this can become a daily practice that can help calm and center you for the work of the day. Another reason that this is so important to me, I spend a lot of time thinking about advocacy. Advocacy is an essential imperative, but also, I believe, a foundational element of our roles as nurses and as healthcare leaders in whatever role we portray. Advocacy for each other, for our patients and their families, for our team members, for our organizations, for our communities. Think of the role that nurses play in advocating for those who cannot advocate for themselves. Maybe that takes on a policy framework for you, and you've been able to employ your excellence and experience and knowledge and wisdom in a way that can really transform policy for the better. Maybe your role is to advocate for individual patients and families under your care. Maybe it's to do that for populations of patients across regions, across organizations. Advocacy is a cornerstone of our work. And in order to be the strongest advocate that you can for those that you serve, we've got to make sure that your tank is full and that you are centered and grounded in mission and purpose. We're going to talk about how to do that. The other thing that strikes me every day, you heard from Tanya, I've had a lot of roles in healthcare for decades in the hospital setting, and now for decades outside of the hospital setting. But I talk to healthcare leaders literally all day, every day. And one thing that I have found to be true is that our roles center around what I call this notion of assuring safe passage. As we try to create environments in which we all can thrive and heal, how do we get each other from where we are today to the next place? When I was a critical care staff nurse in Center City, Philadelphia, 48 years ago, my job was to get that patient and family to the next level of care. Maybe it was to the step-down unit. Maybe it was to the skilled nursing facility. Maybe it was to assist them to have a death with dignity, surrounded in love and care. When I became a nurse manager and a clinical nurse specialist and a chief nurse, my role became one of assuring safe passage of my team members. Maybe it's to get to that next degree. Maybe it's to achieve that next certification. Maybe it's to take on that next step in your career path. How do we make that happen? And now I'm president of a company where every day I try to make sure that my team members are safe, that they know they are loved and cared for, so that they can do the best possible work in supporting all of those that we serve. Safe passage is a critical element in my thinking. When I center on safety and harmony and love and care, I automatically start thinking about and feeling joy and gratitude. I think they're somehow inextricably linked. And that's what I want to explore a little bit with you today. Now, we have so many pressures coming at us from every direction. I know you're feeling it. And the fact that you took an hour out of your day to think about these concepts with me tells me that we really need this. We've got pressure coming from the feds, from reimbursement, from population health, from the social determinants of health, from staffing and workforce implications, from financial pressures. We, in light of all of that chaos, are still accountable to make sure that our patients and their families have safe passage through our systems, and that we, with our leadership, assure that clinical excellence is there every time, every patient, every encounter. That is a ton of responsibility. I also think it's a privilege, and yet with that privilege comes a lot of pressure. At the same time, we're trying to juggle all of these goals and hit all of these metrics. We know that a huge part of facilitating those outcomes is by creating an environment in which we can all thrive and do our best work every day. And that's where the healthy work environment concepts come into play. Now, I want to dive a little bit more into them, and I am really proud. You heard in my bio, I'm a past president of the American Association of Critical Care Nurses. I've said for decades, everything I learned early in my career came from AACN. The leadership at AACN, the past presidents that are my brothers and sisters, have informed and shaped who I am today. And I'm proud that AACN really did the seminal work related to healthy work environments and created, in a very inclusive and collaborative way, the standards that we practice within today, the standards that create healthy work environments. And you can see those 6 elements here. And just be thinking about your work, your team, your organization, your system. How effectively are you executing on these 6 elements of the standards of healthy work environments? They're essential. We know that it starts with authentic leadership. That's why we're talking about some of these attributes and characteristics today. We need leadership at every level of our organizations. And it starts with you, and you being at your best every day so that you can bring your gifts forward in a way that advances your mission and vision. That takes skilled communication at all levels, whether it's with the patient, whether it's with our multidisciplinary teammates, whether it's as you sit at the board. We need that voice everywhere, more than ever. That takes a very collaborative, inclusive approach to our work. No one discipline can achieve these incredibly difficult outcomes on our own. We've got to do that with great teamwork, with strong and effective decision making. Of course, we want to make sure that we've got the right staffing. I know that's a huge area of focus for all of you. We've got to assure we've got the right numbers of people, the right kinds of people, the right credentialed people at the right place at the right time to deliver the care that will evolve to create those outcomes that we need to see. How do we do that? How do we keep the best and the brightest where we need them? Well, a big factor there is going to be meaningful recognition. We know that. I am also a proud, Kirby Bates is a proud partner of the Daisy Foundation. I am a personal partner, a life partner with Bonnie and Mark Barnes and the whole Daisy team, have been for over 20 years. And we know that many of you participate in the Daisy program and use the Daisy program to help provide meaningful recognition to those who make a difference every day in the lives that you touch. So when we think about a healthy work environment, we really need all of these cylinders firing at the same time as a standard, not as a one-off, like, oh, we had a good day today, we hit 2 out of 6. No, we need that to be fundamental to our structure, to our organizational infrastructure. and that we need to focus on these elements. Not again, not once a month at a staff meeting, but day in and day out. Now, many of you have worked on schemas like this one. I know you spend a lot of time creating a vision for your team, for your organization, doing strategic planning. Remember when we used to do strategic planning like for the next 10 years? Ha! We can barely strategize for the next 10 minutes some days. So strategy is changing. We want to have an eye to the future. We want to build confidence in each other. We want to help each other manage what's needed, but do that with leadership integrity, leadership agility, and true teamwork. These are some of the boxes that many of you display in your team mantra, in your team vision. What I don't often see in those frameworks is the bottom layer that I've put in, and that is mission-driven joy. You don't see that in a lot of charts. You don't see that in a lot of graphics to depict your mission and vision. I'm going to try to convince you to start thinking more about joy and add more intentional joy and joy elements into the work that you do with your team. And here's why. We need the most agile leaders in healthcare today than we've ever needed before. We almost all have to be like Gumby these days because the demands are so tough. They are unrelenting. So we've got to be our most resilient selves. We've got to be our most agile, creative thinkers. When those elements are in place, that is where we find our joy. So walk with me for a minute on this one. I know many joyful people. I hope to think that I am one of them. What I know for sure is that joyful leaders, joyful people have created trust with their team members, with their neighbors, with their partners, with their families. They are flexible. They are adaptable. They let their human vulnerability shine through. They bring joy to situations where others might just see despair and negative, and let that negativity be contagious. Joyful leaders find a way to make positivity and optimism and joy contagious. We can do that. That's within our scope and our power to make that decision every day to be a joyful leader, to exude that authentically so that then we bring that out in each other. I know that when environments of care are created with joyful team members and joyful leaders, that translates to the patients and families that we serve, the community members with whom we collaborate, the boards that we sit on, whatever those environments may be. We can infuse these elements into our work. And I do believe that that is where the magic of nursing and leadership excellence really get to shine. There's all kinds of literature about leadership, about positivity, about culture. And I like so many of them, but I just picked out one today. Warren Buffett, very well known to us. One of the things that he said that always really struck me and stuck with me. Let's surround ourselves with people who push us to do better. No drama, no negativity, just higher goals, higher motivation, good times, positive energy, not jealousy, not hate. Just let's bring out the absolute best in each other. Those are cultures that I know we want to be part of. Those are cultures that we want to create and that then we want to maintain and sustain going forward. I even said it with my tennis friends the other night. I'm trying to live a drama-free life. What does that look like? Well, there's some elements to that. And I believe that positivity and optimism and forward thinking help us to get there. Now, you're sitting here going, okay, I'm going to try to feel joyful. Yay, I'm going to leave in an hour and I'm going to feel joyful. It's not that easy because life is hard. We face real challenges. We have true loss and suffering. How can we make this an intentional part of our day? Here's a couple of ideas. See if they resonate with you. How can you bring joy to work? If you can bring it to work, you can bring it anywhere. So let's start with finding our why. We've touched on that a little bit. Centering on our mission, our purpose. I know at Jackson Healthcare, we focus on our values. They are a part of every decision that we make. Wisdom, growth, putting others first. So center in on your why. Get back in touch with why you came into nursing, why you chose to lead in whatever role you play. And then center in on what brings you joy and enthusiasm. I used to do a lot of motivational speaking, and I would ask the audience, let me pull out your to-do list. I know you got one. I know it's sitting there right next to your computer. Get out your to-do list. Are you anywhere on there? Your to-do list is for everybody else. What brings you joy, and how can you make the time and spend the time doing that? Some people say, oh my gosh, I love gardening. I just love getting my hands in the dirt. When was the last time you did that? Connect with those things that bring you joy and enthusiasm, and that's going to reverberate as you move forward into work and life. What skills and talents do you have that you can apply to the greater good? I know we get so busy, locked into what we got to get done today. And we're so busy, so many things on our to-do list. But you've got so many skills and talents, gifts that you can give in maybe a different way. Take all that organizational skill, take that leadership voice. Maybe you can apply it through some work in the community, through some volunteer work. There's all different ways. Those things bring you joy. Fill your tank. We also want to get in touch with how can we be rewarded and acknowledged for the contributions that we're making to the world. Everybody sees recognition through their own lens. What might be very meaningful to one in the form of recognition might not resonate so much with someone else. So figure out what fills your tank and makes you feel seen and recognized and appreciated. And then let the people around you know, hey, this is what really helps me to want to keep coming back and doing this again tomorrow. And then once you start small, maybe it's with a small project, maybe it's with a small group, and maybe that starts to grow and you've created momentum now for others to take that out into the world. That's the beauty of centering on your why and then letting that grow and percolate and perpetuate. Now, this is very brave of me. This is Melissa Circle 1977 when I got my first degree from what was then Gwynedd Mercy College. I think a pathway to joy is by embracing the mindset of a beginner. When was the last time you felt really new at something? It's scary, but it's also energizing and invigorating. And you're learning something new every day. And you're figuring stuff out. And you're growing your confidence and your competence. There is something innately joyful about mastering a new task, mastering a new concept, teaching someone else that. So when was the last time you put on the hat of teacher, mentor, advisor? And conversely, when was the last time you put on the hat of learner, novice, beginner? Both hats are so important. And I think if we interchange them more often and more intentionally, there's a lot of joy to be found in that. So maybe you need to go back and get out your nursing school graduation picture and remember who that person was and what you thought you hoped to accomplish in your career and the difference that you hope to make. and then just sit there for a while. And you, I know, will be just and amazed at all that you have achieved already and all that's yet to come. Spread gratitude and joy. Everybody always says the best way to fill your tank is to give something to someone else, whether that's through volunteering, whether that's through donation, whether that's through some act of kindness, some show of appreciation or gratitude to someone else. That ends up filling our own tanks more than we know. So here's the key. It has to be authentic. It can't just be walking down the hallway or walking through the suite and going, oh, I appreciate you so much. Thank you so much. I'm spreading joy today. No, it has to come with intention and meaning and authenticity. And it has to be specific. What you did yesterday meant so much to the team. And here's why. The way that you said that at that meeting showed that you really heard, you've got your story to tell. Tell it. Don't hold back. Make the time for this. There are so many ways to do that. Some people that I know write little cards, little letters. Laudio is a company that I've become very familiar with, and the leaders there are extraordinary. They are helping you and many teams to intentionally provide recognition and acknowledgement to team members in a very busy world. But think about spreading gratitude and joy in your day. I know it's going to come back and show dividends for you in your own joy journey. And then we got to fuel this. This doesn't happen just mysteriously and miraculously. Just like our bodies need nourishment, our joy tank needs to be fueled. How do we do that? Again, identify what brings you joy. What fills your tank? When something happens and you sit back and go, dang, that was good. Wow, that felt great. Oh my goodness. Those are the things. I know for many of you, it's your daisy celebrations. You can't read those daisy nominations, A, without crying, and B, without being so deeply touched at the impact that you have on the lives of those you touch. I'm on the Schwartz Center for Compassionate Healthcare Board. I'm heading to Boston next week, Monday and Tuesday, to celebrate the Schwartz Center's National Caregivers of the Year. These are incredible people, humans who are in all different roles in healthcare, all different avenues they've traveled to be able to give the gifts that they give. They are joyful people, and it shows in the work that they do every day. Ask yourself this question: what would need to be true about my role for me to stay here and thrive in this role for the next, pick a number, 5 years? What's it going to take? Identify maybe where there are some gaps, where you can make some changes, where you can ask for some help, some guidance, where you can solicit the help of your team members to move in that right direction. But identify what's it going to take and then make that happen. These things just are not automatic. They take work, they take time and energy and intention. So put that on your to-do list and make it happen. And then once you're figuring this out for yourself and starting to really get more clarity on your path to joy and agility and creating health in your workplace, then you will be ready to help influence the team and to create that positive ripple effect that not only we want to see, but that we need to see. It starts with self, and then as we keep moving in the right direction, we can emanate out and make that happen for everybody around us. This can, by the way, this is not just about your workplace. This can be about your family. This can be about your neighbors. This can be about anything, your tennis club. We can exude these characteristics intentionally in our lives. And I'm pretty sure that our communities and our society has never needed this as much as it does today. Another place that we can infuse joy, and we don't often think about this, but I wanted to just give a little shout out to teachable moments. Let's get real here. We are all going to make mistakes. We are all going to fail. Some people think if you're not failing, that you're not trying hard enough. We've spent decades in our industry trying to have an improvement mindset. How many of you remember total quality management, TQM, CQI? We've had every acronym there is for performance improvement. How do we infuse joy and gratitude into these teachable moments? We want to forget the mistake, remember the lesson. Celebrate the attempt. You know, I'm so grateful that you tried that. I know you went out on a limb. I know you stepped outside your comfort zone to lead that effort, to chair that committee, to try that new piece of equipment, whatever it might be. I know that was uncomfortable for you. It didn't turn out all the way that we had hoped it would. We're probably not going to go forward with it, you know, thanks to all your input and all your hard work that helped us see that. But I really appreciate that you tried. I'm really grateful that you took the time and energy to help us understand that. And now we know what we're going to do going forward. So even if something didn't go as well as we hoped, there can be gratitude in the attempt and in the intention. So let's center back on that. I love this. I have this in my bathroom. Purple's my favorite color. You can see I'm in a purple office here. When you stumble, how do we figure out a way to make it part of the dance? I remember thinking about this. I was watching a video of a graduation ceremony, and one of the young graduates, he was in his cap and gown, and you know, he's all decked out. He went up the 3 steps to walk across the stage, and he fell flat on his face. And the whole audience went, ah, you know, there was a gasp. And then this kid, I swear, he did like 5 push-ups right there. He jumped up and he went and shook hands and got his diploma. The place went nuts. And I thought, man, there is a kid that is stumbling and making it part of his dance. I thought, how smart was that? It was wonderful. So we know we're going to stumble. Our teams are going to stumble. How do we make that a learning opportunity, a teachable moment? How do we talk about that in a way that is positive, that is improvement minded, and that keeps us moving in the right direction? I know you've seen this 1,000 times, but I always include it because we have to be the change that we're talking about here. We cannot sit back and wait and expect somebody else to do this. I think too often everybody's waiting for somebody else to pick up the mantle. I guess it's them. It's the they. I don't know who they are. Do you? I don't know. I know in my mind, I remember thinking, if I'm ever one of them, then I'm going to go work at the Wawa. Wawa is in Philly. It's like a corner store, like a fast food kind of place. You can get gasoline there, but you can get snacks there. I would go work at the Wawa because I don't ever want to be them. Now that's hard in some of these roles because we're leaders. And a lot of times our frontline team members, they say them because it's always the leadership who's telling us what to do or saying, no, we can't have this or can't have that. Well, we don't want any more thems and theys out there. We want a lot of us. We are trying to create teams, communities, organizations where we are inclusive, where everyone feels a sense of belonging, and where we're all focused on heading in the same direction toward that mission, those values, the vision. It takes all of us, all roles, firing on all cylinders all the time. So it starts with us. Do the things that make you part of the solution. Take the actions. Make the apologies. Show the gratitude. Be a good teammate. Be a loyal friend. Be a good neighbor. All of these things. Do it yourself. And then you will see the ripple effect that is going to help us create the change that we need to see, that we wish to see in the world. Now, this is disruptive. Now, I personally don't believe in disruption just for disruption's sake, but I love disruption. We need to shake it up a bit so that we can improve and we can continue to grow and evolve to where we need to get. Disruption can be a very positive thing if done well. Disruption done with leadership and integrity and positivity can be so effective. People want to be part of that. They want to be on that new team that's trying something new. They want to be in with that group that's going to challenge the status quo and blow it up and start over. And let's see how that works. So I think you need to ask yourself, are you a positive disruptor? Are you one who wants to just keep everything as it is because I'm comfortable here and I don't want to step outside my comfort zone? Where are you in that? How can we help you to be a positive disruptor that is improving and part of a positive evolution to a healthy work environment that is based on all those leadership characteristics that include joy and gratitude and agility? So disruption, let's be disruptive, but let's do it in the right way. Now, there's all different ways to do this, to really flex your agility muscle. This is something I came up with at Kirby Bates. We have a lot of great conversations. We want to be at our best selves. I am surrounded by the best in our business, hands down. I will guarantee you that many are on this call who we have touched at Kirby Bates. Same with Tipton. An amazing, amazing group of colleagues who are making a difference every day. Well, do a little assessment here. We call this left to right. So on the left side, you see afraid and risk averse, permission seeker, scarcity, punitive, anecdotal. You see a long list of kind of some negative qualities or characteristics that can really be informing your team culture. They're not healthy and they're not joyful, that's for sure. And they're not going to get you where you want to go. Where we want to go is to the right sided list, not afraid and risk averse. We want courageous. We want people stepping outside of their comfort zone. We want you to feel like you are empowered, not a permission seeker. We don't want to live in scarcity mindset. We want an abundance mentality. Punitive has no place. We want supported. We can't deal with just anecdote. We want the evidence base. We don't want inflexible. We want fluid and agile. You can see the dichotomy between the left and the right. We don't want favoritism. We want fairness. We don't want criticism. We want appreciation. We can't just survive and hang on for dear life. We want to thrive and bring out the best in each other by being solutions oriented, to be forward in our thinking, to break out of these silos that have been inherent in healthcare since Skippy was a pup. Breaking out of those silos, moving to what we call at Kirby Bates one team. So on your team, at whatever level that is, how are you doing with this left to right evolution? How are you disrupting the left-sided qualities and characteristics and not accepting them, not tolerating them, pointing them out in a teachable way so that we're moving individuals and therefore teams and organizations toward the right? This is an easy exercise that you can do with your team to get their feedback. How are we doing on all of these things? And as we move toward teamwork, what does that look like? As we move toward empowerment, what does that feel like? As we move toward solutions orientation, what will that take? These characteristics on the right not only help us create very agile teams, they will inherently help you build a joyful team and one of gratitude because they're built in. They're part of the DNA of that right-sided list. When we are focusing on appreciation and supporting one another. When we have an abundance mindset, it's just like when the tide rises, all ships rise. That's what this is. This is doable. We've done it. It's not a one and done. It requires continual effort, always checking in to see how are we doing. Maybe we need to revisit some of those sometimes, but it's just something for you to think about, another tool, another exercise you can do very easily with yourself. Start with yourself. How are you on those lists? And then build that out to your team. Now, none of this happens without trust. And trust is a word we talk about all the time. One of my favorite definitions is the extent to which one is willing to ascribe good intentions to and to have confidence in the words and actions of another. If we don't have trust in each other, if we are not trustworthy, then none of those right-sided characteristics are possible. So we have to walk with integrity. We have to keep our promises. We have to pay attention to each of these things. This is one model that might be helpful to you, the ABCD trust model. We have to have the competencies and capabilities to do the work, because nobody's going to trust you if you're incompetent. I think that's a pretty fair statement. We have to be believable and authentic in our work, in our communication, and we have to be connected. We have to know each other. Now, I know I've been criticized for decades about being too close to my people. Well, they're not your family, Melissa. Yes, they are. They're my family, and I love them, and I want them to be here, and I want them to be healthy, and I want them to be happy. I think that's my job, whether I'm a nurse manager, a chief nurse, or president of a company. I have infused that into my DNA for over 40 years. And you know what? Most of the time it works really, really well. But connectedness is what we all seek. We have a lot of individual contributor roles in our organizations. That doesn't mean they can't be connected to each other, to you as the leader, and to the work. Now, that requires dependability. Nobody's going to trust you or be connected with you if you don't keep your promises, if you don't show up, if you don't do your homework, if you're not prepared. So these are just another couple little checkpoints that you can look at to see how well prepared you are to deliver on these things that will help you get where we're trying to go. Now, everybody that knows me knows that I'm a huge Duke Blue Devils fan. We've had season tickets for Duke men's basketball for 28 seasons. This happened last season. This is Con Knipple holding on to the leg of one of our players who has possession of the ball, is about to fall flat on his face and about to go out of bounds and lose possession. And he sticks his leg out. Con grabs his leg, holds him in bounds. We retain possession of the ball, win the game. Teamwork. This is my best view of teamwork I've seen in a long time. And translate this to each other. How many of us are sticking our leg out and hoping that somebody grabs onto us and holds us in bounds, keeps us with possession of the ball, and lets us go on to play another play and win the game? I had to throw this in there. It's relevant. It's teamwork, and it's a great visual. But you know, people give us subtle and sometimes not so subtle examples all day long that they need help. They may not be comfortable asking out loud for it, but we are trained in observation. We are nurses. We are skilled in all of those elements of assessment. We got to get better at assessing each other, treating each other like we would our patients. Hey, you seem a little off today. Are you okay? Is there anything I can do for you? We know that a lot of times when somebody's acting out, or whether it's a patient or a teammate, and they're just unhappy and miserable and nobody wants to be around them, peel that onion. What's underneath that? So often it is fear. People are scared to death about losing their job, about paying their bills, about a sick parent, a sick child. I mean, the list goes on and on and on. So we owe it to them. We owe it to each other to grab that leg, whether they've asked us to grab it or not. Grab that leg and hold on tight and help us retain our dignity and get to the next place. We know that this is not about separation. Very hard to talk about this divisiveness that we all feel right now. We are here to create togetherness, unity, We don't all have to be like-minded, but we do have to share vision and values. That's how our organizations go forward. I've heard it said, and I do love this, what you appreciate appreciates. So let's just appreciate the heck out of each other's hard work, all the effort that goes into doing, I think, the most important work there is. That is taking care of others in whatever role you play. We can get past all the expectations we have of each other and the grind of it all and focus on appreciation, knowing that we can see these results every day. Start with gratitude in ourselves, gratitude in our roles, continue to cultivate trust in our teams, and then live and lead with joy to create those healthy work environments. It's not the joy that makes us grateful, it's the gratitude that makes us joyful. We're coming up to Thanksgiving. For those who celebrate, it's a time of reflection. It's a time to talk about our gratitude, to share our gratitude. It is a gateway to joy. I've seen it myself. I try to practice it every day, and I hope that you'll take some of this with you for not only today, but for the future. This is what I'm going to end with here. It's about joy. I slept and dreamt that life was joy. I awoke and saw that life was service. I acted, and behold, service was joy. There's never been a better example of service and selflessness and leadership than there is in our beloved profession of nursing. You make a difference every single day. And I hope you feel seen and recognized and appreciated for the difference that you make every day. Thank you so much. Tanya, you sick of hearing my voice yet?
No, that was so wonderful. I'm feeling inspired and feeling joy and gratitude for you sharing all of that with us today, Melissa. I know it's sparking lots of thoughts and inspiration for others as well. In the minutes that we have left, I would love to invite anyone from the participant group. If you have a specific question or something that you would like to share, we invite you to put that into the chat, and we will share those with Melissa and ask her to speak to them. While we're waiting for some of those chats to come in, Melissa, one thing I was thinking about as I was listening to you, you've given us so much food for thought, so many great places to start. And I wonder if people are thinking about, how do I disrupt the status quo and bring some of this in when my staff or my colleagues are resistant to change, even if it is, we need it for a healthy work environment, but oh, how do I keep the momentum going?
Yeah, that's a really, really good question. There is resistance out there. I hope I didn't come across as making this like all, la la land. This isn't a fairy tale. This is hard work. I always, when it comes to the resistors, those who resist change, there's a lot of them out there, no doubt. One way that I have found success is trying to co-opt them into the process. There's something about it, not that anybody's our enemies. There's something about trying to keep the resistors close. That it's been said, keep your enemies close. These are not our enemies; these are our teammates. But is there a way to co-opt them into the process? I remember an example in one of the units that I was running years ago. We were trying to implement new infusion pumps. This back in the day, it's an ICU, and oh my gosh, I can picture her like it was yesterday. There was one person who was just arms crossed and no, doesn't want it, not going to do it. I said how much I pulled her to the side and I said how much we needed her. She's such an influence, very senior nurse on the team. I asked her, would she co-chair the committee that's going to evaluate these new pumps? Because that way, if they're terrible and it's really going to be an awful thing for us, she'll get to tell us that and we're going to listen. She was like, wait, what? No, I don't want to do this. I'm like, I understand it. But co-opt her into the process. It was great. She ended up being very influential, but in a good way, helping us to see the pros and cons, and then being able to say, to make good recommendations that we went with. And then she felt like, oh, good, she was seen and heard, and we got the best outcome for what we needed on the unit. So I don't know, there's probably no one answer to that, but I think sometimes drawing them in, co-opting them into the process helps. And then I'm a big proponent of peer-to-peer engagement. Um, there's times where, staff nurse to staff nurse, they have to hold each other accountable, and they've got to kind of tackle some of these peer-to-peer. Like, I know, you seem so negative. I know you don't want to help me understand. Use the right language. Don't be attacking. Help me understand this. But I think co-opt them in, hold people accountable. And you know what? It's hard to, and I've said this 1,000 times, people get to have a bad shift. Everybody gets to have a bad day. My thing is, you just don't get to have a bad decade. Okay. Just, we had something happen last night. I didn't get any sleep. I'm off today. Okay. Let me know that. I'm going to be here to help you. But if that's a repetitive characteristic that makes it very difficult, I think then we have to intervene. I think as leaders, we have to intervene and set the standards that we expect of each other. Yeah. Now, Tanya, somebody's saying that
Oh,
the
yeah.
chat, can they
I'm
put their,
seeing that we have gotten a couple of great questions though. So maybe if it was disabled before, just enter that back in again because it does seem to be working now. One person asked, how do you disrupt without stepping on toes? So that's a great lens to be curious about.
I don't know if you can. I don't know. I guess the question is, how do you disrupt without crushing toes? Because I think you
Mhm.
gotta step on them a little bit, but maybe we do that with clarity, with intention. And maybe we use language such as, I'm not disrupting, or not, you have to use that word. I'm not making an issue here just to make an issue. I feel, tie it back. I think that the way this is going right now is not going to help us achieve our mission. I
Mhm.
think this way is holding us back from whatever the goal is. That's why I would like to see us change it. And I know you're really vested in this. I know you helped create this, and I appreciate all of that. I just feel like you can do feeling terms. You can say,
Mhm.
I've done a lot of research on this in the literature, and I
Mhm.
see so many good examples. Would you be open to working with me to just do a small test of change? I know that's like, this is Tipton language because you all are out there as the experts helping with frameworks and tools and assessments. Is that what would your answer be on that question, Tanya? You've got great experience here.
Honestly, I would agree with you. I think that it doesn't feel like stepping on toes when you do it through collaboration and partnership.
Okay,
And
good.
so exactly what you were saying, how do you bring them into the why and what and a new vision? And it's a lot of sort of like, let's inspire a shared vision together of what we are hoping for and then partner to move that forward. And that would be a great way to
Yeah.
alleviate some of that feeling of stepping on toes. So I think you
I,
gave a
I,
beautiful
I think
answer.
trying to understand, like, I often say, what's the worst that could happen? In
Mhm.
many of these scenarios, we can try something. If it
Yeah.
doesn't work, we can try something else.
Yeah.
Um, Not everything is so life and death, like, no, it's all or nothing.
Right.
We can make small steps toward improvement and
Hmm.
then build on those rather than do nothing because we don't want to disrupt anything. Yeah, I think you got to step on some toes. Who said that? I kind of, I know I can't stand it. I won't say it. Got to break some eggs to make an omelet, something like that. I
That's
mean,
right. That's right.
you
I
don't
know
want
we only have 1 minute left, so this is only if it can be done in a brief
to,
period of time. But another great question: how do you get joy back when your hospital has been through large layoffs? Such really hard change.
this is hard time. This is not a 1 minute answer, but I'm going to do my best.
Okay.
But that question hits my heart. We
Yeah.
are working with colleagues and clients every day who are in the throes of tremendous change
Yeah.
and not of their own choosing.
Mhm.
So, how do we find joy? We have to look for it.
Mhm.
And maybe it's not going to be like, oh, I have joy now. No, it might just be one little thing today that you did or that you tried that made it a little bit better than yesterday. I think you have to set manageable expectations for yourself because it is hard. Multiple rounds of layoffs is tough. It creates fear and anxiety. And there's no one solution to that. But
Mhm.
maybe we just start a little at a time. Maybe today, do one thing for yourself. It could be take a walk, breathe fresh air. It could be, something, doesn't have to cost money. It can be something, get a partner, find a friend, do one thing that makes you laugh. Do
Yeah.
something that makes you laugh out loud. That is good. Do
Yeah.
something, have a healthy meal that is good for you.
Mhm.
Take a moment, 5 minutes, and just quiet and
Mhm.
just think. Those are the best. I mean, I'm not in any way marginalizing the feelings that you're having, because it is a devastating time for many in
Yeah.
our industry and in the world right now. So
Yeah.
start small, start with one thing.
Wonderful. Well, thank you so much. There are other really great questions and thoughts that I'm sure will come up as a result of this incredible conversation. Melissa, thank you so much for your time. What wonderful insights you've shared with us. And thank you to everybody out there who has joined us for this. And we look forward to seeing you at the next Tipton webinar. You will be receiving your evaluation and your contact hour for this. And we look forward to the next time that we have you all together again. I hope everyone has a really wonderful rest of your day.
Thanks, everybody.
Thanks, everyone.
Have a great day.